Defensive medicine. What is defensive medicine?
Defined as doctors' deviation from their usual behavior or that is considered good practice, to reduce or prevent complaints or criticism by patients or their relatives. The definition further encompasses the action of ordering investigations, procedures and visits, or avoidance of high-risk patients or procedures with the primary aim of reducing malpractice liability. Earlier, doctors took pride in making a diagnosis based upon clinical knowledge supported by years of experience. The eyes, ears, nose and hands supplemented by the stethoscope were their diagnostic modalities. However, this art of palpating, percussing and auscultating is slowly vanishing, and the ever-evolving science of modern medicine is becoming defensive day by day.
What are the causes for shifting to defensive medicine?
Defensive medicine might actually be an evolutionary approach of minimizing clinical error and managing a patient through best diagnostic modalities available. Although it might look more expensive and cumbersome to the masses, it may be enabling the doctor to be absolutely sure while taking a decision for the patient's well-being. Any patient can see a specialist or super specialist bypassing a community doctor or a family doctor. The specialists then are extra cautious while dealing with such patients by means of ordering specific investigations. So, seeking specialized help for even minor illnesses may be an additional factor for the phenomenon. A large number of corporate hospitals, private clinics and nursing homes have been providing quality services, but at a cost. The advanced and costly investigations tend to generate more revenue for the institution. Monetary gains can also be in the form of incentives or cut money to the referring doctors, though it cannot be generalized. Here, the irony is that most of the times the patient and the relatives are satisfied that a specialist or super specialist is being called for further evaluation or treatment of even minor ailments. Many also think that more costly the investigation and medicines, the better is the physician. The most recent, unfortunate and probably the most significant cause is the workplace violence which medical professionals are facing on a routine basis. This practice has instilled fear in the minds of doctors, and therefore, they go for more expensive and invasive procedures, just to protect their skin in future. So even if a doctor knows that pain in abdomen with which a patient has landed in emergency is mere gastritis just by history, examination and sound judgment, still he or she tends to write ultrasonography, just to avoid violence for missing any rare cause. Due to this reason, some hospitals are denying admission to severely sick or injured patients, as it might induce violence in case the patient has an adverse outcome. In the age of internet, rather than giving history, patients give you diagnosis on the basis of superficial web search and self-prescribed laboratory tests which they have already undergone. Many a times, such patients request for specific tests, and also, sometimes drugs, like antibiotics. Doctors oblige them, for fear of losing the patient to a competing practice, or to avoid any argument with the patient and their relatives. Health institutions and medical professionals are being sued for hefty compensation in the courts, so practicing medicine, which was once an art and science, has become more of a professional obligation. The patients and attendants, who on arrival request a doctor for help, suddenly become violent and try to encash the adverse situation. The media has also played a role. Without having a holistic view in supporting evidence, they flash big headlines on countless newspapers and television channels implying medical negligence. Today, in the age of mobile technology, any person can shoot a video, play victim of medical negligence and defame a health institution or a doctor in seconds. The media trial and comments that follow are enough to dampen the enthusiasm of a doctor, and to drive him, her to play safe. The undue and unwarranted interference by elected non-medical public representatives in health institutions has further worsened the situation. Doctors also have to take care of the ethics code, which have been framed for patient management and protecting the rights of sick and deprived against malpractice. So, to avoid any controversy and conflict, modern-day physicians rather than going with their judgment tend to go by the book.
What are the advantages of defensive medicine?
There is increased certainty of diagnosis. There are decreased incidences of alleged medical negligence leading to lesser chances of health professionals and institutions being defamed as well as dragged to the court of the law. It also saves the doctor from the violence-driven mobs, occasionally seen after an adverse patient outcome.
What are the disadvantages of defensive medicine?
Increased out-of-pocket expenditure for the patients, insurers, and/or the exchequer. Relying too much on external diagnostic and treatment aids has led to the creation of microspecializations and further handicapped medical science. To some extent, it has undermined the skills of budding doctors and even blunted the more experienced ones. The establishment of health insurance, as suggested, is likely to increase the practice of defensive medicine.
What are the solutions for defensive medicine?
Acknowledge the existence of defensive medicine. The difference between need, desire, and option of investigations must be highlighted. After consulting different scientific medical agencies, standard global guidelines for the need of investigations, use of technology, invasive procedures, and use of drugs must be laid down and followed to the core. There should be regular medical audits of all health institutions. The concept of community physician or family medicine must be revived and strengthened. Except emergencies, the primary healthcare facility should be the first point of contact of the patient and the chain of referral should be maintained. Tertiary care institutes with their expert professionals must be reserved for the advanced and complicated ailments. The concept of quaternary prevention in healthcare, which protects the patient from overdiagnosis and overmedication, must be given due importance. The long-standing demand of act for violence against doctors should be met at the earliest. Further courts of law are also requested to take obscuring factors like lack of facilities and health staff, low wages of professionals in the public health institutions while labeling medical conduct as negligence and passing judgment. Media must also act responsibly in a non-judgmental way and acknowledge the poor plight of healthcare workers. Political will and commitment are also the need of the hour. Public representatives have every right to check the working of institutions and report wrongdoings, but too much interference will make doctors more defensive, leading to increased denial to admit sick patients, referrals, and out-of-pocket expenditure. Autonomy of the institutes with professional independence, with necessary checks and balances, is need of the hour for proper functioning of academic institutions, and of those working in them. As the National Health Policy, 2017 recommends, India should spend 2.5% of its GDP on health. Human resource must be recruited as per standards and taking enormous population of the nation into account. Medical fraternity also needs to set a good example by doing ethical practice themselves.
How do we see defensive medicine in the future?
Defensive medicine has evolved, thrived, will prosper in future and become a standard or norm. We may need to find ways to subtly incorporate this aspect into the modern medicine one way or another. The National Medical Commission has incorporated the attitude, ethics and communication competencies for the Indian medical graduate curriculum. While teaching this module, we can devote some time to defensive medicine also, thereby sensitizing the future doctors about this practice. While some defensiveness is needed in today's context, too much of it will erode the ethos of medical practice. Benefit of doubt should always be given to the doctor when he takes a risk to save the life of a patient in emergency. It is a joint responsibility of doctors, common man, government, judiciary and administration to strike a balance between the different approaches of modern medicine.
Please like, comment, share and subscribe.